So what does the Lancet series on midwifery tell us? What does the combined evidence from all of the papers that have been presented, what are the key messages, if you like, and the important things to consider for decision makers and professionals into the future? Our evidence is really suggesting that what we need to consider is a system level shift from a focus on care that's really looking at addressing pathology for the minority of women who have problems, through to planning for skilled care for all women to prevent and support them to prevent those problems happening. And our evidence suggests that midwifery is pivotal to that system level shift, and that it could have a considerable impact on the really important outcomes that would accrue. Our evidence is also suggesting that the views of women themselves and families and communities should be at the core of planning services, so that they are appropriate for the needs of women and babies and for the setting in which they are living. It's absolutely central. Our evidence is also suggesting that midwifery is associated with a more efficient use of resources and improved outcomes when it's provided by midwives. It's also suggesting that respectful care is absolutely essential for improved health and well-being of mothers and babies. So care that's really focused on the woman and her needs and treats her with respect throughout the process. And care that strengthens her own capabilities to care for herself, her baby and her family will be care that then, if you like, optimises those medium and long-term outcomes, because she will be knowledgeable and empowered to care for herself and not reliant on others. The evidence also shows that midwifery fares best when it's within a functioning health system in which it is embedded and in which it's supported, so that systems of referral are straightforward, where there are no barriers to that care working for all women and all babies. So where care is accessible, it's affordable and is free from undue pressures of commercialisation that may be, if you like, pushing towards an increasing level of intervention. So that relationship between midwifery and the health system in which it sits is absolutely critical. Within that health system, it's really important to focus on coverage, and by coverage we're talking about the numbers of practitioners, midwives and others who are providing the care for women and babies. So we need coverage, we need more people, if you like. But at the same time as we're building up coverage, we need to be building up the quality of care. And we shouldn't be focusing on doing the coverage before the quality, but the coverage at the same time as the quality, so that the kind of system that is built, the kinds of providers who are being brought in to provide that care are doing that at high quality from the start. Otherwise, a health system is playing catch-up, if you like, trying to retrain practitioners when it should be training them appropriately right from the start. And finally, what our evidence is saying is, for that to happen and for that quality of midwifery care to be available, for it to make the impact that we want, we have to address some pretty fundamental barriers to midwifery. And again, we've seen those across the world. Those involve the low status of women. Those involve the over-medicalisation of care and at times the dominance of midwifery by medicine in some settings. And the impact of over-commercialisation, so that there is somehow a pull towards using equipment and conducting interventions that really are not necessary. So there are barriers to midwifery, and Maybe prime among them has until now been the lack of understanding, the lack of evidence, the lack of information widely available to decision makers about what midwifery is capable of and what midwifery needs to thrive from the health system. And the Lancet Series on midwifery provides a foundation for building that understanding into the future. We have a really important research agenda that will be coming out of this series and will be a subsequent paper flowing out of this series and trying to fill in some of the gaps. We have another paper flowing out of the series that will be digging down more at the really important aspect of respectful care and rights-based care and how midwifery can support and enable that. But once we have all those papers in place, we have a very, very strong foundation now of knowledge and understanding for decision makers everywhere, for health professionals everywhere, and indeed for women themselves and their families and communities to really understand the impact that midwifery can bring into high income settings, middle income settings and low income settings for all women, for all babies everywhere.